All right, Liam, quick briefing on Mrs. Henderson in room 7. She's stable post-cholecystectomy, but her pain management is proving a bit dynamic. The patient-controlled analgesia isn't quite hitting the mark for her incisional discomfort, despite repeated boluses. We tried adjusting the basal rate earlier, which seemed to initially help with the general ache, but her breakthrough pain episodes are still quite frequent, especially with movement.
Right, Mrs. Henderson, PCA not fully effective. Mihira, should I reassess her pain scale again, perhaps look at her facial expressions more closely?
Precisely. Beyond the numerical score, observe her nonverbal cues. Also, she's expressing some nausea, sporadic, but it's impacting her oral intake. We've got Zofran on PRN, but let's consider if it's related to the opioid or perhaps her diet. And don't forget Mr. Peterson in room 12, his blood glucose has been fluctuating wildly. His morning insulin dosage needs a meticulous double-check today and ensure he's adhering to his diabetic meal plan, especially after that unapproved biscuit delivery from his family yesterday. His hyperglycemia last night was certainly a consequence of that.
So, Mrs. Henderson's pain and nausea, then Mr. Peterson's fluctuating glucose and diet adherence. Got it, Mihira?
Excellent. Prioritize Mrs. Henderson's pain first, then delve into the nausea. Mr. Peterson's glucose management is critical, but perhaps less immediately acute than Mrs. Henderson's discomfort.
Mihira, I want you to know that dealing with a staked nail can be worrying, but there are gentle, practical ways to protect yourself while you heal. The most important first step is rest, because giving your foot or hand a break helps your body focus on repairing the tissue underneath. Along with rest, proper nail care matters a great deal. Keep the area clean and dry, and trim your nails straight across to avoid extra pressure or tiny cuts that could invite trouble. Wearing protective gear like sturdy, closed-toe shoes or thick gloves when you are working outdoors or in risky spaces can prevent this from happening again. Now, while many small injuries get better on their own, I also want you to watch for signs that your body needs extra help. If you notice spreading redness, swelling that keeps getting worse instead of better, any yellowish or greenish pus, or pain that does not ease even with rest and gentle cleaning, please do not wait. These signs could mean an infection is starting, and a doctor can give you the right care to stop it quickly. Your health matters, so trust yourself to reach out for help when something feels off.